And it's not unfair to say that many public hospitals in South Africa have become a death trap for the poor. Many institutions suffering chronic staff shortages, long waiting times, and also a lack of proper equipment. And nurses are on the front line of this crisis. And now from the Nursing Association, the Nursing Union DENOSA, I'm joined by Simon Hlongwane, who is president of the organisation, as we continue with our special focus today on the state of public hospitals. Welcome to you and thank you very much for joining us. How would you describe the current state of public hospitals in South Africa, given, as I've just mentioned, your members are on the front line and are risking their lives each and every day?
Well, thank you for having us, Jeremy, and greetings to the viewers. I must say that with COVID-19 having tested the resilience of our public health system, and generally including the private healthcare system in South Africa, we are worried that even now we seem not to be getting our acts together, because we've been saying in the past that there is not enough resilience from our public health system, but we thought maybe even the private sector has got a better way of dealing with it. Now we receive complaints even now from clinics, from hospitals of shortage of nurses, but over and above that, even shortage of what we call PPEs to date. It is appalling because we ought to, from March to now, be much better and much prepared. It's even worse because the staff complement that is currently being utilized to assist to work in the facilities, particularly public health facilities. There is a number of contract workers, nurses, and other health professionals that have been contracted by departments from around May and June, and they were given only a contract for a year or some 6 months and so on, which means when that time comes, currently they have no job security, no guarantee that...
I want to rewind, yes, Mr. Hlongwane, if we can, and I want to focus on personal protective equipment, because that is of concern, because it's a huge fault line in the system exposed by COVID-19. When you put pressure on the authorities 8-9 months into the lockdown to say, where is this PPE, what are they telling you?
Well, there are those who come with an idea that you can do with a surgical mask in this environment and so on. But we have said in the past that what we need is to treat everybody who goes to the hospital as if the person is positive of COVID-19 until ruled otherwise. Therefore, it means you must have full protection to make sure that we prevent health professionals from getting infected by COVID-19. But we find even other areas and institutions where they will say, as management, because we are running short of certain PPEs, we can't provide you with, for example, the coveralls, we can't provide you with the shoe covers and many others, the knee boots and so on.
All right, let me ask you this question, Mr. Hlongwane. Given that we might be facing a second wave of coronavirus, does your organisation have any confidence at all that the situation can be rectified in the short term, or have you simply given up?
Well, we are comfortable, and we are comfortable that we can put more pressure, but we must send a very stern warning out there. If there isn't seriousness from the side of the departments, from the side of the employers, to make sure that there's a maximum protection of nurses and other health workers. The health workers are not going to risk their lives because they will just be risking. There's many health workers who died, and now their families are suffering, and they cannot risk that for their children and their families.
Thank you very much indeed. From DENOSA, Simon Hlongwane, I want